going to be in English, and it will be for the next 45 minutes. And I just want to give a brief introduction about Dr. Ashok Kumar Garu. Dr. Ashok Kumar Chinni is an cosmetic dental surgeon by profession. He is a naturopathist, and he is an Meru Chikitsa expert, spine care professional, and he is an advanced medical nutritionist, and he is also a certified diabetic educator. So for the past few years, he has been treating more than 400 people, cure their diseases naturally without using any medicines. So that is about Dr. Ashok Kumar Chinni Garu. He is having a clinic at Hyderabad, and this session is going to be in English. And the instructions for this session is, I request all of you to take a notes of all the points, because Dr. Ashok Kumar Chinni will be taking care, taking us through the basics of diseases, what are the root causes of diseases, and he will be giving some data points on how to interpret the reports, how to interpret our body, the symptoms and all. And also he will be giving a solution on how to cure diseases naturally at home. So most of the are which are actually born in India. Diseases or the treatments that Sar is going to tell us are the ancient practices of India. So I request all of you, please take in notes of this session. So if you take good important points of this session, this would be very useful for us for future reference also. So Dr. Ashok Kumar does these educative sessions every often. So whenever he gets time, whenever somebody requests, he does these educative sessions just for free of cost, for awareness, just for awareness. He does these sessions. So I request all of you to please take advantage of this session. And if you have any doubts, please make a note of all the doubts. And at the end, we can have a 10 minutes question and answer session where you can raise your hand and you can unmute and ask your questions and get them clarified. Yeah. This is the introduction, and I just hand over the session to Dr. Ashok Kumar. And welcome to you, sir.
Thank you, Vinodji, and good morning to all. Am I audible?
Yes, sir, you are audible, sir.
Okay. Before starting the session, I would like to ask about what is disease. You can chat or unmute and speak.
Is it some abnormality in the body?
Abnormality in the body. Okay. Why that abnormality came? We can switch on our videos. How it would be if I also close the video and start speaking? When we are communicating with each other, when we want to share with each other.
That is because of the practice of the yoga.
What practice?
No, we don't switch on the video, you know, like when we are doing the practice for the yoga.
Mm.
Yeah. So
How that abnormality came?
Yeah, probably like, I mean, naturally, like if you have some mutation in the body, if some of the like foreign proteins come in, and if you have some like bad proteins coming out, like something like that. Yeah.
Yes, exactly. You said about foreign proteins like that. Tomorrow is our Independence Day.
Yeah.
We got independent from foreign people who came into India for the purpose of
Evading.
business. Yes or no?
Yes. Yes.
First, they started the conversation with India just for the purpose of business. Later, slowly, they occupied the country. And it became a big burden for us to get them out of the country. Take them out of the country. What I can say in easy language is that is also the similar thing. Something has entered the body, and which is previously it is in harmony. When the harmony is disrupted, when the harmony is damaged, then only we can say that a disease has come. Do you agree?
Sure.
Okay. I will be speaking, and if at all any questions are there, we will answer at the end of the session. In this next 40 minutes talk, first we will be teaching about, we will be talking about the what is disease, how the disease comes, and how we can cure the diseases. Whatever may be the disease you can think of, all the diseases will be answered in this question, and our target is to bring the awareness on everyone's mind. Till now what we are thinking it cannot be cured. For each and every disease we are rushing to a hospital for curing. But can you tell me any disease with the medicines it is cured completely? Even at least a fraction of the disease is cured completely? There is no answer, because no disease can be cured with the medicines. Okay, we'll see all the things in a sequence. Just have a look. See, right now we can call everything as a disease. Diseases of two types. One is real disease and other is the pseudo disease. Means disease is not there, but we are thinking that it is there. It is there. If at all real disease is, then it can be cured. But the pseudo disease, which is not at all there, how can it can be cured? What are the signs and symptoms of a real disease? Real disease means the discomfort will be there at the body level. The body will indicate us through weakness, fatigue, breathlessness, flu-like symptoms. Flu-like symptoms means cough, cold, fever. Digestive symptoms, stomach pain, loose motions, vomitings, pale skin, sleeplessness, swelling, pain, tumor, very high BP, less urine is coming out, paralysis, extreme sleeplessness, extreme stress, extreme itching. These are all the symptoms which the body is indicating. If at all these things, whatever may be the disease you can consider, only these things will be there. There is no other thing which you can add. All the 16 signs and symptoms which the body indicates to us for any disease is through these things only, majorly. This is the way how the body conveys to us for indicating some illness. Then what about the other thing? Pseudo disease. What is this pseudo disease? Second. What is this pseudo disease means? Pseudo disease means that disease is not there, but we are made to believe it is there. Just like the case of the oldest disease like polio, to the present, everyone is using the mask in the fear of that corona or monkeypox or whatever you may. Earlier, the same rehearsals is done in case of swine flu, all those things. And ultimately, slowly and slowly, the fear is created. Once the fear is created and you are identified in the name of that particular disease, slowly you will come to fall sick through the medium of some banned drugs or the fear or the unknown hospital treatments which are done. Slowly you will become a real disease patient. Has everyone seen these pictures earlier?
No.
We have seen these type of testings, quarantine, coronavirus. Is there any other way to know whether corona is there or not other than that so-called RT-PCR test? Who has designed that virus picture? Has anyone seen real the virus? And if the virus is so small, can it be seeing that quarantine gate and it will be waiting there so that it cannot spread? The virus is such a small thing that no mask can filter the virus. Whatever the mask which we are using right now, the virus size is 300 times smaller than the size of the mask. So nothing can be used to filter the virus. Till now, the science is not that much developed. If a healthy person is labeled as a patient, either in the airport or in the railway station or in the bus station by testing or by mass testing, then actually because of the fear they become ill, not because of any pathogen. We are doctors of in 2021 24th May only, we 161 doctors have written an open letter to Modi ji and all the chief ministers, Ayush ministers, MPs, MLAs, district magistrates, saying that there is nothing called corona. There is nothing new called corona, and not a single death has occurred because of the corona, because of the so-called corona. And we have written all the documents supporting evidences in the international journals, and we requested for any proof of the coronavirus also. But as usual, no one replies for this type of things. And we didn't stop at that moment. We have set separate camps in different areas, and we started treating the people at their home with the help of just food, sunlight, yoga, meditation, dancing, playing. And what we have created is a just friendly environment. We are under the guidance of that Dr. Bishrup Rai Chaudhary, and what he tells us is the simple thing. If at all you see any corona patient, first go and male person should go and hug the male participant, male person, patient. Like that only we will welcome the person into our camp, and the females will hug the, so that the mental fear will be gone. And we didn't use any mask, sanitizer, PPE kit, nothing. And the instruction for is is that we will be sitting along with the people throughout the day. There is, here in the picture you can see even your small kid patients are also there, and in the picture only you can see the fruits and vegetables are served as a food for them, and kashaya, some kashaya decoctions, all those things. The bunk beds are there. We'll be sleeping there only. We'll having lunch, dinner, breakfast, everything there along with them. This is a 1100 bed COVID center established at Ahmednagar, Maharashtra by the local MLA Nilesh Lanke. And as we are doing from the last few months, later we requested NIN, National Institute of Naturopathy and Ayush Ministry, to conduct a thing what we are doing. They take the initiation and they came to the thing. And for 3 months, they have done the observational study. After that one, they said, with this protocol, what we call as NICE protocol, we can cure from mild to severe cases also without any death rate, without any mask and oxygen cylinder, nothing. We can cure. Later, they have published that one in the book of Delta 72. And what you call so-called RT-PCR test, recently we have done something other. We have taken the non-human blood samples like fruits, vegetables, pigeons, dog, rabbits, all these things, and we have taken them to the RT-PCR lab, where we identified even the cockroaches, tomato, rat, mosquito, even the housefly getting corona positive. This you can do for yourself. No need to believe us. You take any sample which is available in the home randomly and take it to the nearest RT-PCR lab and ask them to do the test. Just tell them to do 10 tests for that one. Just you need to do 10 tests. In that one, some will be coming positive and some will be coming negative. Then what that means? Even the rat is positive, or the cucumber is positive, tomato is positive. That is just like a fake test. The truth is that every 10% of the test which you are doing, it will become positive. So if at all today I want to say there are 1 lakh case corona cases, what I need to say is, what I need to do is 10 lakhs tests, so that we can prove that there are 1 lakh positive cases. Here what they are doing, telling is the cases, not the patients, that we need to consider. Cases are different and patients are different. And all the evidences we have published in this book, Naked Truth of COVID Test. See, suppose whatever the movies which we are seeing, if you want to watch the movie, means someone has started producing the movie and someone has directed the movie and some actors acted, and all this is recorded and later it is produced in the theater. In the same way, whatever the corona, so-called corona, which we are doing, thinking, it is already, there is a thing called this even 2201, Melinda and Bill Gates Foundation has done this event in October 18th, 2019. Means 2 years before the thing, they have done the mock drill for all these things. This is available in the internet. You can see all the videos, everything. This, they have prepared the thing. They have made when the vaccine should come, how the testing should be done, how the news should come into the media, how the fear should be created, so that everyone can be prepared for the things, so-called new medicines. This is all documented. The same thing is done for the next upcoming latest fashion disease, that is monkeypox. Here you can see in the image, the news image is GNN Live, May 10, 2023. how the news should come next year also they have prepared. Whatever the pictures right now, which the Times of India or Hindu newspaper are showing, it is the same archive picture which is there from the last 17 years. That image is used for the last different purposes. They have done all the documentation for the next 1.5 year so that we can safely go through the monkeypox. When the news should be shown in what way, what the news should come in the January, May, and when the vaccines and medicines should come, all the preparation is done for this purpose. What we need to do is just be aware. This is how the RT-PCR test for the monkeypox is like looking like. This costed us 1.5 lakh. With this one RT-PCR test for the monkeypox, we can do 48 tests, which it says, and it is already made in China. What it says is it is prepared in June, and all the preparation is done in which lab it the test to be done. Everything is going down, and we have asked the ICMR and WHO, is there any evidence to prove that this monkeypox is coming? Do you have any evidence, or have you seen any cases where that monkeypox looks like this, and whatever the so-called medicines which you are prescribing, are they tested for that one? You can see in this image, they are saying currently there is no demonstrating data for the effectiveness of the treatment, and it is similar to the kind of smallpox. Means whatever the thing is there from previously, which no one can identify, each and every year they are saying different names to sell their medicines, to make everyone into the traps of these businesses. How can we say that this is so-called monkeypox? The media has already prepared us with the form of, if the monkeypox happens, you will be having the headache, fever, weakness, body ache, rashes on the skin. So many people every year will get some or other rashes, just like in the case of the smallpox. And the same thing is happening. If you see the T-pox medicine, which is launched recently, that also has the same side effects. And whatever the so-called vaccines which we have taken previously from the last 1.5 to 2 years, that also has the same side effects. Means whatever the side effects of the medicines are there, or the vaccine side effects are there, they are prepared to us in the form of the monkeypox. So it is all the journey from the pseudo to a real illness, which is really happening right now. There is nothing other than the testing kit. If the testing kit, you think that there is no testing kit detected for that one, what you call this coronavirus, the common cough, cold, fever, and what you will call this monkeypox, so-called monkeypox, the smallpox, or the general flu, which happens every year for so many people. And in the case of this monkeypox, the occurrence ratio is maximum 20 to 25 tests, one will become positive. So if I want to prove that there are 1 lakh cases, what I need to do is mass testing of 20 to 25 lakhs. Automatically 1 lakh cases will become positive, and the medicines they are already launched for this one. This is not new. Whatever the thing which we are doing, that pseudo to real illness, this thing is not at all new. The same thing is practiced from ages, from the so-called allopathy medicines. When they are discovered, they will be launched like this only. You can see the case of this blood pressure. Before 1970s, the so-called blood pressure, it will be considered as 150 by 90. But as from the guidelines which we are following from the WHO, they say 120 by 80. Different organizations will be using different things, and whatever the things which we need to follow is according to the body. What we say is listen to the body. Other than the readings are secondary. First thing is what your body is telling to you, how it is indicating, what it is indicating, that we need to listen. As Cochrane guidelines, remember this word Cochrane. See, this is the organization which takes funds from the government only. Even India also supports this organization. Their guidelines are not dependent on any pharmaceutical companies or those who are working in their company, in their organization, will not be in touch with any pharmaceutical company. So the readings which they give are completely safe. The Cochrane says 160 by 100 is the normal range of the blood pressure. So whatever the readings which we are considering, that even the school kid also knows that 120 by 80 is the normal blood pressure. This is the thing how we need to trap the people into the disease. This is the case, same thing with the cholesterol. In before 1978, 300 reading is considered as the normal cholesterol level. Later, after 1998, it has been brought down to 240. So that whatever the people which you are seeing above 240, they become ill. After 1998, it is brought to 200. At present scenario, anyone who goes to your doctor above 40 years, they will be given that anti-cholesterol medicine, statins. And cholesterol medicines are so dangerous that they will be categorized into the X category medicines, so that if at all anyone who is going to become parent, if at all they use those medicines, they will become impotent. They can't produce any offsprings in future. Those medicines, if at all anyone is taking the cholesterol medicines, directly you can stop the medicines right now. There is no use. Later in the media also it is said that cholesterol medicines are a mistake made by us, but that will be shown in a small column, that won't be highlighted. And the doctors, as per the books, they should not have advice, but they are following the rules of the pharmaceutical companies. So only they are prescribing these medicines. The same thing is with the TSH levels, thyroid hormones. So many people are following, taking the medicines. If you ask anyone who is taking the thyroid levels, they will be saying different things. T3, T4, TSH. Only one reading need to be considered in case of the thyroid, and the reading which they say as per the any lab is 0.3 to 3. The normal range which the thyroid should be 0 to 10. That is the normal range. Before 2003, it is 0 to 6. Actually, it is 0 to 10 is the normal range. If at all you are having any thyroid, taking any thyroid medicine, you can start considering them, tapering them. The same thing is for the blood sugar also. As per the ACP guidelines, 2018 March 6, they are done with the help of so many randomized control tests, RCTs, and all together put together, and they did the meta analysis, and they brought all the results came together as 250. 250 is the normal sugar level. And how the 250 should be there? For the blood sugar, they will be considering fasting and postprandial. Both together average. Means suppose if at all the fasting comes as 200 and postprandial comes as 300, the average is 250 only. So what we can consider as 250 is the normal range. If at all you are taking any diabetes medicines and you want to check whether I am really diabetic or not, as per the latest guidelines, you can directly stop the medicines for 3 days and check yourself whether you are really diabetic or pseudo diabetic patient. Whatever the things which we are seeing all the time is for the medicines. Here I am taking the example of the paracetamol. This is the oldest allopathic medicine which is available. It is from almost 200 years. From the last 80 years, whatever the tests or RCTs conducted. RCTs means, suppose blind test. Some people will be given the paracetamol and some people will be given the placebo. Means they are not given the paracetamol and checked how it is, how the disease progresses. These tests I am placing in front of you. All the tests, what they say is this one. Paracetamol is the most frequent cause of the liver failure. This is as per the books, Davidson's Principle and Practice of Medicine, 23rd edition. This is considered as the Bible of the MBBS or MD, whatever. By studying this one only, we will be prescribing the medicines. In the books, never it is prescribed paracetamol in case of the fever. And European journal says it is the most dangerous medicine in the world. Paracetamol is the most dangerous medicine. The journals say like this, whatever the books which we consider as the holy books, they also say like this, but the paracetamol is available even in the Kirana stores also. And just at the call of anything, you can get the paracetamol. This is the most common cause of the failure. Here I would like to tell an example of the small thing for everyone. The case of, have you seen Tirupati? In the Ghat road, we will go to the Tirumala. What we will be doing is we will be going through different curves, and so that we will be going safely to the top. Here we can see so many accidents are happening. So there are two approaches for safe journey. One approach is to drive safely and to make a humps at the curves or bends, and in the night also, whatever may be the speed of the vehicle, to protect that one, there will be big barricades at the turnings, so that if at all by mistake also, if it hits the barricade, it doesn't fall into the forest or the valley. And in the night also, to make the people aware, they will be setting night lamps or different radium stickers and radium logos for the safe journey. This is one approach. And the second approach is, as the accidents are happening, to make a multi-specialty hospitals available for them, and to make a big cranes. If at all the vehicle falls into the valley, within minutes the cranes can remove that one, and whatever the body parts are missing, they will be rearranged. New body parts or artificial limbs, artificial eyes, everything is placed within few hours with the help of so many big hospitals, and people to be prepared for the big policies, medical insurances. Which one is safer, you think? Whether the first approach or the second approach? What we are doing right now, we are preparing for the illness. We are thinking of why the disease is not coming. We are preparing ourselves for the sake of insurance. Whatever the earning which you are earning, you are keeping some amount for the medical problems. Means we are preparing. Our focus is completely on the not the preventive part. Our focus is on the treatment part, which is not at all there at present. We are, as we are preparing for that one, and so many people in the name of the, earlier it is considered as a medical profession, is considered as a holistic profession, Vaidya Narayano Hari. The quotation is also like that. Doctor is considered as a god. Right now, medical profession is became like a business. That's why this, in the name of the hospital, so much of looting is happening around us. Please mute yourself. We can answer all the questions later. What we want to convey today is through the how a disease is identified. Anytime you go to a lab or anything, they will be taking a blood sample and they will be testing it through the blood medium. As medium only, they will be testing whatever the disease which you have, and same through the blood as medium only, we want to help you to cure yourself. Generally the problems come either because of the blood impurity, or in some parts of the body blood is not able to reach, like if the hand is not functioning properly, which we can consider as a paralysis or partial stroke, whatever it may be, or some part of the body has some tumor or stone which occur because of the less flow of the blood or overflow of the blood. All these things can be corrected just if you correct your blood, or what you can say, if you make the things so that the blood will circulate properly over that part, the body can cure itself. Just through the medium of the blood, all the diseases can be cured. Just what are the diseases which can be considered through the blood purification? Whatever the diseases which has the weakness, fatigue, breathlessness, flu-like symptoms, digestive symptoms, pale skin, sleeplessness. Here you can see there are 8,500 types of diseases as per the documents. Whatever the diseases which you know in general, like 60 diseases common, like diabetes, BP, blood, cholesterol, all these things like this, which all you know, the 60 types, all these things can be cured just by correcting the blood. Whatever the impurities happened, sugar levels abnormal, blood sugar or blood cholesterol, blood pressure, all these things are blood related. All these things, whichever blood creatinine, blood urea, whatever the things which are wrong with the blood, once you correct the blood, automatically that disease will be erased from our life. How you need to correct it? Just change in the diet, DIP diet. What is DIP? DIP diet, that will come to know in the next slides. And in some cases, blood redistribution. Like I said, in some part of the body, maybe because of the stroke or paralysis or the tumor or the stone, whatever it may be, or some obstruction, the blood is not able to reach. Once it is not able to reach, some part of the body is impaired and will get some swelling or pain or tumor, and there is some low urine output, or all these things will happen. This can be done also at home completely without the help of any hospital, just through the medium of DAP diet and hot water immersion, HWI. Here we are taking along with the food, there are some other techniques which can be done at home so that you can come out of the illness. What we want to say is everything, whatever may be the disease, it can be cured at home. What are the tools which we are using is the heat, gravity, and food. These things which are available at home, with the help of these things, each and every disease can be cured. This is a very important slide for you. Eat the food with life. In each and everyone's life, what we need is the guru. Once the guru is there, we can come out of any illness. What I want to say is eat the food with life. We want to live for longer. So whatever the food which we are consuming, that food also should has the life. What is the food with the life? Whatever the food which the nature has prepared for you, all the food has the life. What is the life means in that one? Suppose you take a cucumber or a apple or a mango and make a juice of that one and keep the one drop of the juice under a microscope, then you can see that something is shaking, moving in that one. Those are called live enzymes. Those are called incretin hormones. Once that incretin hormone is there in our food, then it can decide where that food should reach and what action should it follow according to the harmony of the body, so that whatever the disease which you have, that can be corrected and it can provide the nutrition for the body. How this nutrition, whatever the food life which we are destroying, is through heating and through processing. Whatever may be the packet which you are consuming, whether it is biscuit or bread or jam or juice, whatever it may be, everything it will write in the terms of nutrition as calcium, sodium, potassium, energy, how much you get, but it won't write about the life, how much it has. How the life goes means, suppose you brought a tomato and keep it in the home, it will stay for some time. Once you heat it and make the curry out of this one, hardly it will stay for a few hours. Means already the damage has started happening. That way we are, by heating the thing, whatever the incretin hormones which are there in the vegetables and fruits, we are damaging the incretin hormone. That's why we are getting the diseases. This, for this one signaling hypothesis, Guntur Blobel has got the Nobel Prize in 1999. This is the DIP diet, disciplined and intelligent people's diet. Like, as everyone is practicing the yoga to maintain the body in some harmony, to maintain the body from the disease, to remove the disease completely, what you need to follow is the simple, this one slide. What is the DAP diet says? Suppose if my body weight is 70 kgs, 2% of my body weight, I should provide the right food in the form of fruits and vegetables in their original form. Say till 12 noon, I need to eat at least 1% of the fruits as the right fuel, and later whatever the thing, idli, dosa or whatever it may be you want to eat, you can add. First you need to put the right fuel which has the live enzymes, then you can eat whatever the routine breakfast which you want to eat, you can consider. In the same way, in the lunch and dinner also, 0.5% of the body weight, means 350 grams of salad or fruits or steamed vegetables. Right now, directly you cannot eat the vegetables which are very hard to eat. If you want to eat, you can steam them so that they will become little soft and you can consume. Then you can eat the routine food which you want to eat, the home cooked food. And the same thing is for the dinner also. And along with this one, what we advise is you take the support from the sun god in the form of sunlight directly on you 20 minutes, and take the support from the mother earth by being touched with the mother earth 20 minutes at least. You touch, walk on the barefoot on the soil, and 20 minutes yoga, meditation, yoga, dance, playing, gym, all these things, and 10 minutes of meditation. Only thing which you need to consider is you should not take any animal and processed foods. See, I have explained previously also that processing thing to increase the shelf life, unknowingly you will be damaging the food, and you will be adding so many toxic materials in the form of dioxins or dioxin like substances, DLS. Like that, you will be creating the disharmony in the body. This one slide, if you follow, whatever the general diseases which you know, all the thing will go. On this slide, on the DAP diet, All India Institute of Ayurveda, many Ayush Ministry के नीचे काम करते हैं, they have done the clinical trial in 2018. What they have observed is in the Shalya Tantra department, they have seen for the back pain people also, this diet plan is effective, and their prime study is for the back pain people. And what they have seen, that the thyroid, even the blood sugar and blood pressure is also getting corrected once you start this diet plan. See, right now, All India Institute of Ayurveda also has approved this one, but this is not published outside. This is not told to everyone, because everything is a business. By just following this diet plan, within 3 days, you can see a change in the diabetes, and slowly you will come out of the diabetes. In 3 days to 1 week, you will come out of the BP, cholesterol, intestinal disorder, even the thyroid also you can see the shift. Thyroid, generally what I have seen in my practice is in hardly 1 to 2 months, slowly by tapering, you will come out of the thyroid problem only. And in just 1 month, if you strictly follow the same DAP diet, arthritis will go, and the kidney dysfunction which is there from the previously, slowly you will see the changes. Obesity starts going down, liver disorders coming down, heart diseases coming down. In 6 months, whatever the so-called incurable asthma, you can come out of the asthma. In 9 months to 1 year, all the skin diseases started disappearing. Even the advanced stage cancer also start disappearing. See, whatever the disease which is far from the stomach, like skin disease, which is far from the stomach, it takes around 2 to 3 cycles of the blood purification to completely cure the disease. Blood will be purified within 3 months. Everyone knows that complete new blood will be coming in the next 3 months. The same thing. I want to give this testimonial to you. She is Dr. Deepthi. She has consulted. She has the constipation issues from the past few years. She has visited so many doctors, so many hospitals. Being a doctor, she knows who is the best. She has done the routine to all the things. Even she has visited so many nutritionists also. She has visited the celebrity nutritionists who charge 3 to 4 lakhs just for that one for 3 months in the Mumbai also. But there is no use. At the end, when she visited us, she got rid of the thing completely within 3 weeks hardly. See Vishalakshi ji, she is 50 years old. From 2008, she is a diabetic, and she got rid of the diabetes in just 3 days. What we advised is food, gravity and heat. some particular design which we have created and gave them to them, and which they followed, and automatically they came out of the thing. What we need is a small planning which is designed strategically, and from your side you need to put the effort and continue the plan. Automatically you will get the solution. From diabetes to dialysis, common cold to cancer, whatever may be the disease, you can come out of the disease automatically. This is what I want to share. Now it is the time. If you want, you can ask some questions. Vinodji, if you want to add anything.
Sir, can you hear me, sir?
Yes.
Is my voice audible, sir?
Yeah.
Yeah.
Audible.
Yeah. So, sir, actually, I'm traveling, so there might be some disturbance in my. Sir, thank you very much, sir. If we look at the last week, this week's presentation, you have given more insights on diseases, how to interpret reports, and also there's more of a presentation, sir. Thank you very much for that.
Okay.
Want to have any questions? We can please unmute and ask Dr. Ashok Kumar, sir. If you have any clarifications,
Yeah.
you can unmute and ask, sir. So, the questions would be unmute చేసి అడగొచ్చండి సార్.
You can unmute and ask. Anyone who want to ask, you can unmute now. This same type of talks we have created in our Sri Rama Wellness channel. YouTube channel is there. In that one, we have made the videos how to cure your cancer, how you can do the bypass surgery at home, or how you can remove the gallbladder stone, or whatever the so-called surgeries which you know, how you can do yourself at home. And we have published in our Sri Rama Wellness channel. You can see that one. Yeah. Anyone you want to ask? Yeah, Bhaskaranji, you can ask. You can unmute. I have made unmute, I made the settings. You can unmute. You cannot unmute. Vinod garu meer kuda antena? Settings aithe change chesanu. ఒకసారి అన్మ్యూట్ బటన్ నొక్కండి సార్. ఇక్కడ సెట్టింగ్స్ అయితే Bhaskaranji, I have made you a co-host.
Okay.
Now can you unmute all?
Unmute all.
Allow participants to unmute themselves. I have already done, I think.
Yeah, I think now I can unmute.
Yeah.
It says that the host has to allow you to unmute.
Yeah.
Yeah, I have a few general questions. Like, first of all, I would like to find out what is Cochrane, like COCHRANE. Is it a association or something like that?
Yeah, it is a Cochrane is an independent organization in which the party they will be getting the funds only from the government, not from any pharmaceutical companies.
companies.
so that they can provide the correct data. Whatever the scientists which they are working there, they won't get any income also from pharmaceuticals.
Is it international or?
Yes, it is an international organization. Even the
Okay.
India also provides some fund for that one. That's why we can get the correct data from that one.
Yeah, and then one of the places you just talked about like fasting glucose and the postprandial glucose.
Yes.
But the postprandial, you mean actually after taking the allopathic medicine only you talk about the postprandial, isn't it? So that means that allopathy comes into the picture. So you cannot only if you are taking some medicine, then you can just call it as a postprandial and then take the average and whatever it is.
When we are checking the blood sugar level, generally we check 2 times. One is the fasting and one is the postprandial. And for that postprandial, with just having the food and without taking the any medicine, you need to check.
Oh, without taking the medicine. Okay.
Without taking the medicine. Even for the thyroid also, if you want to check on that day, you should not take the medicine and go to the lab. The same thing.
But normally the labs and all, they just ask you to when they want to check the postprandial, take the medicine whatever you take, so that they will come to know like how your medicine is acting actually, isn't it?
See, the labs is a big mafia, and
Yeah.
that's why the disease is continuing. If you really want to know how the disease is there, you need to check like this: fasting and postprandial, just after the food 2 hours.
Yeah. And then one other thing is, so can you call this the diabetic as the deficiency of incretin?
I can call every disease as a deficiency of that guru in the life.
Oh, okay.
When the guru
Yeah.
is there, whatever may be the problem which you have in the life, all the problems will vanish. In the same way, whatever the diseases which you have, when the guru is there in the food, that guru will correct whatever the diseases which you have, that guru will take care.
Yeah, but I was going through that the internet, but it says that it only the incretin type of drugs actually they are something like GLP-1 or DPP-4 or everything related to diabetes only. But they are not talking about any other diseases.
Whatever the things which you are, which in general we are seeing, is the thing which they want to show.
Okay. So it should be okay.
What they want to show is to improve their sales of the medicines or disease labs or whatever it may be.
And like when the yoga ji actually the Mr. Vinod was telling, like you have to have this the raw vegetables, something like that. But suppose people are having a kidney stone or something like that, so they have to avoid the calcium oxalate or something like that. So they just wanted to avoid these tomatoes. So how do you know that if you don't know that you have a kidney stones, and then if you are taking tomatoes every day morning or something like that,
how the kidney stone is coming to know us? How we can detect the kidney stone?
Yeah, that's based on the urinary tract, something like that. So if you come across, or even you can have a urogram or whatever, urograph or whatever it is.
See, here, whatever the thing which we need to focus is just based on the test. No one is identified healthy till now. Okay, right. So no need to focus on the test. Focus on the thing, how the body is indicating to us, whether through any illness or pain or whatever it may be. And just for casually, I'm saying, if at all the kidney stone is there, what the doctors say is, you should not eat this, you should not eat that. Just go to the doctor, note whatever the things which they are telling,
right.
Just do the ulta.
Yeah.
Automatically your kidney stone will dissolve.
Oh.
Because even the doctors are trained like that. Even
Yeah,
they
that's-
don't know that that is the thing. Even the same kidney stone happens to your doctor, they will go on for the same type of procedure which they are doing to us.
okay.
Even they are brainwashed to depend on the medicines, surgeries, or whatever the so-called procedures which they are going. That is the same reason, the same thing they are doing for their family members or to us.
Okay. Yeah. Thank you. Thank you very much.
Yeah,
Appreciate it.
yeah. Anyone want to ask question? You can unmute and ask. Okay. If there is no questions, thank you. Vinodji? Yeah.
Thank you very much. Excellent talk. And then, yeah, after a long time, I'm just getting a very good talk. It will be useful for our future and things like that. Thank you very much.
Thank you. Thank you, everyone. I'm closing the meeting.